Hello, I think we're
Hi.
going to get started. Welcome, everyone, and thank you for your interest in learning about this growing need of housing in the community we serve at Momentum. And I want to especially thank Silicon Valley at Home and a special shout out to Executive Director Regina Williams for including this important issue in Affordable Housing Month. And so, wanted to introduce myself briefly. My name is Shefali Miller. I'm the Chief Medical Officer at Momentum for Health. And one of the intended co-hosts of this event, Dave Mineta, our CEO, is out today. He had to tend to some family affairs. So I'm filling in for him. And I will also be introducing our other co-host, Cedric Anderson, in a minute. Real briefly, I wanted to touch on our agenda for today. I'll give you an overview of Momentum for Health, who we are, what we do, and then move quickly into the main focus of this event, which is talking about behavioral health housing needs in our community, how we see it unfolding, and the efforts we've made to address it. We'll share some client stories that really highlight some of the pertinent issues here and leave some time for question and answer at the end. So with that, I'll move on. Tell you a bit about Momentum for Health. We are one of the largest nonprofit providers of mental health services in Santa Clara County with a staff of 500 employees representing 45 languages. So we really strive to have our staff be as diverse as the community that we serve. We have multiple locations throughout the county with 24-hour availability in different levels of care. We serve over 4,000 adults and youth each year from Santa Clara County and the larger Bay Area. And the population that we serve, 85% of our clients are Medi-Cal recipients with low or no income. And as you can imagine, these are the faces of the individuals who are facing housing insecurity in our community. And this is one of the needs that we feel is high on our priority list to address. We really strive to provide whole person care. Although we are a behavioral health provider, we really think about the whole person in the services we provide. And you may have heard the term social determinants of health. This is the idea that non-medical factors contribute significantly to health outcomes. So while we do provide the services you might expect, the therapy, the case management, the medications, we also know that those treatments will only go so far if we're not addressing the social determinants of the mental health of our clients that we serve. These are things like poverty, food insecurity, housing insecurity, social supports, access to community, access to healthcare. So these are all the things that if you don't solve for those problems, you're not going to make any movement forward in the recovery of the individual. We meet clients where they are in their recovery journey. We partner with them. Our care teams really meet them where they're at and try to understand what is going to be necessary in their care plan to get them to their recovery. So that we offer a range of services, from the acute treatment services, such as crisis stabilization, crisis residential programs, to ongoing outpatient care, as well as housing programs, supportive housing, crisis residential housing, to address those needs that they have as well. So now I'm going to move on and introduce Cedric Anderson, our Deputy Chief of Outpatient Programs at Momentum for Health. Cedric, I could go on for this entire 30 minutes just telling you about Cedric and what he does for Momentum and for our community, but I'll try to keep it brief. So Cedric has been at Momentum for 13 years. He's been in the behavioral health field for 27 years and 2+ decades working on housing, specifically housing related programs, treating individuals across the lifespan from transitional age youth to older adults, and has been instrumental collaborating with our county in standing up first of their kind programs in housing in our community to help individuals at need. He's been pivotal in developing a pilot program at Momentum that he'll tell you a little bit more about at our 11th Street facility, developing a program that we think can be a model for future housing programs to serve this population. So with that, I'll hand it over to Cedric to share our story here.
Thank you, Shefali, for the warm welcome. It's nice of you. So here at Momentum, we serve some of the most vulnerable and low-income people. Recently realized that there's a growing subset of folks that we're serving that they're at the intersection of housing and behavioral health crisis. We are well aware stable housing is a must for successful recovery, as Shefali was mentioned, as far as social determinants. And when you're looking at, this basic Maslow hierarchy needs, right? Stable housing is the cornerstone of that, safe, secure, and looking at social economic factors. It's estimated about 16 to 35% of our clients are unstably housed. Of that, 74% are Black, Indigenous, and people of color. Let me get this. Sorry about that. Missing the slide here. Oh, here we go. Here we go. Approximately 2,000 and 4,500 people are housed countywide, and that number is growing each quarter. I do want to recognize that the county has done a great job providing additional housing support. I would say from data shows from 2019 to 2022, in Santa Clara County alone, there has been 6,000 new housing opportunities. And so this number is more so between 3,000, but that number is growing each quarter, as I mentioned. Stability. Stability is the key, for housing recovery. It really allows for our clients to focus on recovery as their priority for today. I just think about for us folks that are considered, somewhat high functioning, without stability, our clients don't get enough sleep. They don't get the proper nutrition. It can impact employment, therapy, and essentially whatever else is related to one's recovery. So when we're looking at stability, we're also looking at the client's well-being, and our research shows that it also reduces stress and anxiety for many of our clients. It's just knowing what to expect on any given day, feeling confident in dealing with whatever happens. And without that, clients aren't able to focus on the coping skills that are necessary to live a healthy lifestyle, and which ultimately impacts their quality of care. Without stable housing, adults are, sorry about that. So adults that's leaving our stable housing program, in our crisis program, there are 1.5 to 2 times more likely to return within a year. Many get stuck in that perpetual cycle of homelessness. Let me keep up with the slides here. Many behavioral health clients generally have additional comorbidities, which results in poor functioning status. Like I mentioned, it impacts quality of life and health outcomes. And so this slide here, we're going to get into a couple recovery stories. The first is Donnie. Donnie came to us actually through a call center. Most of our clients come through the county call center. He was a client that was deemed as a high-end utilizer within the healthcare system. He was unhoused, living under bridges and encampments, and struggling with his addiction. And since Donnie's been with us, he has actually been doing a great job, and we're going to jump into Donnie's story.
My name is Donnie Davis, and I've been with Momentum as far as the early 80s, but its name has been changed since then several times, but it's still all the same. It's still Momentum. And I'm here to tell you that my strength and my hopes to this program, which has saved my life. I have been under the drug laws cocaine, crystal meth, marijuana, all was cleaned up by me coming to these programs and meetings with momentum. Uh, they know me inside and out. I would not say like they love me. They take good care of me on any issues within minutes. If I can call within 15 minutes or 10 minutes, there's someone calling, Sonny, Donnie, what's the problem? What can we help you with? They're very good with that. Well, the third thing was homelessness. Nobody couldn't cope or deal with me. I couldn't even deal with myself at the particular time. Well, when I first got in the mental health system, how I got in the mental health system is I had a nervous breakdown. That was said on the news, in the paper and everything about me. I was walking down the street naked. I had took my clothes off and didn't even know it. And that's what started my, back in 1975, which started my mental health that got me where I am here today. So that was a lot of reasons. I went through the court system. I got cleaned up, and I proved myself to them. And so they said, Donnie, we're going to have a place for you to live that's going to be rightful for you. And they did. How do you say? They gave me the house with white picket fence. And they trusted me with it. And they still trust me with it today because I went for it. I'm currently living in supported housing. And I do what's suggested and everything. I started my spiritual. I started back to church last year at Christmas time, and I'm doing well with that. And as far as my mental, I take one pill at night at bedtime, and I don't have to worry about it. I will take a Arcane for the side effects, but my medicines are doing me really great. I'm able to focus better. I'm able to see what direction in and understand other people's needs and wants. But I have been in lots of programs here and there, but nothing beats momentum. Nothing beats momentum. And it's all about respect. And it's respect. Respect is a very, very important thing. And what they respect us to keep the place clean, to keep ourselves clean, to feed ourselves, and make sure that we keep everybody happy all around us. Because life is too short to be going through a whole bunch of struggles when all you have to do is just relax and take it easy. Yeah, because they're going to take care of it. They'll take care of the problem for you. I would like to stay where I'm at right now for as long as I possibly can. I'm 65 years old, and I'd like this place to be my retirement home, however I can, because there is other people that need to go. And when it comes time to move on, they'll move me to that other section. All this has is a section. It has a section for the younger, the older, and the oldest. So they'll have another home for me when I can't do for myself anymore. They'll send me to a home that will be taken care of. They have places like that. So I just would like to say thank you for your support and keep doing what you're doing because it's important to us. We need to get these words out there. We need to let the people know that there's help for you. All you have to do is seek it.
Donnie is one of our superstars. He's doing great. And since Donnie has stepped down to our lower level of care, he's maintained his housing, for the last 6 years, actively working his treatment plan, and it's just been a ball of energy and pleasant to work with. Next, we have, we're gonna share the story of Mara. Mara has a very interesting story. And so likewise, Mara comes to us as been a high-end utilizer of the system. Unfortunately, there's been a lot of trauma that's taken place in Mara's life. She's been an advocate of housing. She's been, struggling to find housing that actually meets her needs. And when she was with Momentum, she was the voice. She was the voice of others. And we're going to get into Mara's story.
My name is Mara Raquel Souza Munoz, and my pronouns are she, her, and ella. I've been with Momentum. I was actually a client of Momentum about 25 years, and then I even started way before then. Like I said, probably in the late 80s. Probably the first real trauma that I had was not bonding with my mom in a developmental way that was healthy. So that was very distressing. I know. In my development, and caused a lot of issues for me, mental health challenges, the first one. And then maybe the next one was I was later diagnosed with ADHD, and I had to repeat kindergarten because I didn't necessarily want to follow all the directions and do everything that the other kids were doing. And what the example that my mom said she was given was that the class was all finger painting, and I wanted to mix it with Crayola and do it my own way. And I just wasn't mature enough to go to first grade. And so that was kind of the next, that was kind of like maybe my first diagnosis. And then I had depression in 5th grade and went really withdrawn because my best friend had committed suicide. And then at 14, I started hearing voices. And but yet, no matter what, at 20, I started having mania. So, then I got schizoaffective disorder diagnosis, which runs in the family, So I think, it's something to think about, there were so much more than any diagnosis or so much more than any mental health challenge. And I haven't really allowed it to hold me back because I still went to Columbia, South America, my senior year of high school and studied abroad, taking medicine, but I studied abroad. And I came back, got an AA degree in bilingual cross-cultural studies, and graduated from San Jose State with a double major, psychology and social work. And, after graduating from San Jose State and working as a case manager, and then I was part of the private part of the agency in Miramonte when I still had medical insurance from my ex-husband. And I was, I got vocational services to help me continue to get jobs at Miramonte. And I was actually my vocational counselor from Miramonte that saved my life, who called Adult Protective Services, seeing bruises on me. And it was like, we're going to have to, report this. And that was my entry into the public mental health system. For the future, I would like to see a lot more permanent housing for clients in the system, and it's very much a shortage of housing in Santa Clara County, period, for everybody. I was kept off the street for 25 years because there were programs to catch me, and I want to start crying, but there aren't now for people. I'm fine, I'm not here for myself, well, maybe for my son too, but I'm here for all the people that need this, for the people that need programs to catch them, and they need permanent housing. Honestly, even living in supported housing, I knew several clients that never even bothered to unpack because they didn't feel it was worth it, because they were going to get sick and then have to go back to the hospital and they'd be back, the same thing, carrying all their belongings in a garbage bag, from place to place. And that's how it is. Advocating for people in this housing, I think that it's sad when we go to the hospital, we can lose our placement and then we're back in the same thing. And if it's not permanent housing where we get to go back home to our permanent home, we can't get stable. I finally got stable and really started being able to do the inner work of really doing my healing and recovery when I finally had stable housing. And for a lot of people, it really means permanent housing. Transitional housing just really doesn't do it, you know, because you don't know whether tomorrow, when you're going to start getting a notice of when you might need to leave. And you never really feel comfortable that you can just relax, you know, just what's like Maslow's hierarchy of needs. If your need for basic housing isn't met, you can't work on all these other needs.
And I like to share that Mara, she's doing exceptionally well. I am so proud of her. She did transition to another organization here within Santa Clara County. And as she mentioned, just the challenge of securing permanent housing here, it's tough, you know, it's just not enough. And she was fortunate enough to get on a lottery system, and she was able to get a single resident occupancy for a limited income tax credit property that financially meets her needs, and she's doing well. She continues to advocate for those that are in the system, including Seth, which is the next client we're going to share his story. Likewise, Seth and Mara are great friends. Seth has come to us challenges, unhoused, went in and out of the system. He has a pretty kind of traumatic background, regardless of whatever independent housing is available for Seth. He is one of those that the structure, living on his own, doesn't suit him well as far as his recovery. He needs to be in a home that's shared. He just doesn't trust that he will be able to survive independently. Although he's showing a lot of resiliency, you know, I can respect where he's at in his recovery, and we're going to share Seth's story now.
My name is Seth Messina, and I've been a Momentum client for 16 years on the housing and 2 years before that elsewhere in Momentum. When I was 2, I got a shot in the state of Massachusetts or Vermont, and it caused me not to speak until I was 4. And as I was diagnosed with autism at 13, Asperger's autism, high functioning, I do have empathy. And I would feel anxious when I got treatment at first because I didn't want to be taken away from where I was at, which later became the best favor of my life, being raised in foster care. My foster mother raised me really well. My mentors and or late mentors activated empathy in myself. I could strive to be compassionate, and I'm into antiques. I like that people call me, I'm an old soul. I like antiques. I was experiencing, when I first came to Alliance at the time, Momentum for Mental Health, the symptoms of severe depression. They encouraged me. I took some therapy in the very beginning, and I had good doctors. I have good doctors still. I have a good doctor still. And I seeked out advice on how I should do things. And they were good. They're good staff people. They have my best interests at heart. I was staying at Crossroads in 2005, and my friend Mara and her late friend encouraged me to look into supported housing. So I filled an application with my point person, and I got in within a month or two in February of 2006, February 7th. I signed the lease just before with a landlord. We have a good property manager now. She's been there for a long time, and she's cool, she's friendly. And when I first got into housing, I felt so refreshed. Learning life skills, independent life skills. I believe the housing program has encouraged me to be more independent, more self-sufficient, and cook my own food and be a better cook, and enjoy life the way life should be, like Maine, the way life should be. I don't want to live alone due to my diagnosis of depression. Depression being in that it's a moderate depression, clinically called severe depression. I want to stay up in the mountain of positivity, not in the valley of negativity. And my gardening I do bonsai trees, and it uplifts me to do a sweet little amount of gardening each day. Water my plants, trim the sweet little trees. I have a bonsai Saturn peach that I've had for a year, 6 inches tall. I spliced it so I get it into a tropical kind. And I like where I live because I get the breezes off the bay. And yeah, I love where I live a lot. When I received access to supported housing, it helped me grow into a more stable and positive person. Because they just made my housing program for Momentum permanent, because it was temporary, which made everybody like super duper anxious. That's a relief, it's a release, and it's no longer super glue to anxiety. There's no more anxiety about the housing thing. And I'm in locations that I really like and enjoy.
Seth, Mara, and Donnie, definitely all unique in their own ways. And it's just a pleasure of working with them. They're so grateful of housing support that's been provided. And likewise, they seize the moment, they take advantage of the recovery, they're active in their treatment. And whenever they have an opportunity to share the story like they're doing during that segment, they're the first to raise their hand. And while Donnie, Mara, and Seth all have been lucky to receive the support here, there's so many more that are in need of this type of housing support. Okay. There we go. Sorry about that. The need for housing it's so important. For us, it's so important here at Momentum that it's a priority of our strategic plan. Up to 38% of the adults live in our short-term crisis residential program. They're unable to find adequate housing when they discharge. In addition, independent housing sites throughout the county, they continue to close, even though as the need grows, leaving a lot of clients unhoused, a lot of adults that are in the behavioral health system unhoused. In the last 7 months, I can think of 5 independent homes that have closed. Even though this data may be off, but I was involved in kind of rehoming many of these clients. I would say about 45 to 50% of those adults end up going unhoused. And, it's unfortunate, here in this county, our independent homes, they're not the best environment for our clients. Operations seem to be below par. Living conditions are, for many, are pretty deplorable, heavily bug and drug infested. They're so shabby and high risk. There are certain homes that San Jose Fire and will not enter without local PD, but as Mara mentioned, Jess, there's not many homes out there to support clients that are living on fixed income. And so this is what's available. And, for this reason, overall, we really have to do a better job in supporting our clients that are coming through our behavioral health system. Vision. Here at Momentum again, it's a priority of ours. We want to make sure that we're offering as many beds to our clients as possible. We're looking to offer up to 1,000 beds to our clients along our housing continuum and continuum of care. We're not there yet. We are close to 200 beds throughout Santa Clara County, which consist of various types of housing support ranging from crisis residential, 60 beds. We have a adult residential treatment. It's another 45 beds. We have our supportive housing, transitional housing. We're at 67 beds, and with our newly designed independent housing program at 11th Street, we're at 16 beds, and we're bringing on another 6 beds at a at our 6th Street property. And we definitely looking to expand however we can in partnerships here in the community to address the housing need. We are open to any conversation and dialogue with other organizations, community-based organizations, community leaders, housing development corporations, foundation, basically anyone who wants to help some of the most vulnerable people here in this county. We are open to sitting down and having that conversation. Our need, again, as we want to make sure we're providing the best housing opportunities for our clients. They all deserve to live, in places that are respectful with dignity, and an opportunity for our clients to form community and peer relationships, so they can really focus on their recovery. What I would like to add is that, with our 16-bed independent home at 11th Street, it is a model that designed. It's a different model. It has a clinical care component implemented into the day-to-day operations. Staffing consists of supportive housing specialists that are trained to deliver especially mental health services and supportive housing services. Staff are on site 7 days a week from 8:30 to 11:30. Also, there is a peer living aide that is on site in case of any emergency for after hours. Our housing support specialists, although stationed at 11th Street, they are part of our multidisciplinary team that consists of mental health rehab specialists, clinicians, psychiatrists. If they're connected to our SUTS program, they may have an addiction counselor. And likewise, if they're connected to our employment services, it could mean they have an employment specialist that's part of their treatment. What's unique about this site, and this is something that we're trying to replicate throughout as we stand up independent homes, is that we have an ADU, right? And that is a safe place for staff to work with clients on individual therapy, running groups. It serves as a workplace for visiting staff and existing staff. It's a win-win for, client treatment. This is a model that we plan, as I mentioned, to replicate throughout our independent homes. In addition, we are looking to add more adult residential treatment beds. And so we're about 28 more beds that are in a pipeline that we're going to be able to provide to serve those adults in Santa Clara County. And I'm going to open up questions to you all.
Thank you so much. Wow, those were some really powerful speeches that we heard from our clients and testimonials as to where things are at in the current housing situation and how much farther we have to go, but how much we've kind of done so far. And so, we're getting a lot of questions from folks who are attending today on independent housing. You mentioned some of these sites closing down. And I think there's some questions as to what does that mean, independent housing? How are those facilities different from what we offer? And why are they closing?
That's a great question. So independent housing, these are homes that are stood up mainly by individuals that they want to help out folks that are what we consider vulnerable. They do not fall under community care licensing. Essentially, anyone can stand up an independent home. It's not a group home because, at least with the group home, they're governed by a community care license. They're more privately ran by landlords. Many of operators that are running independent homes, they're subleasing. And the issue with that is most homeowners, they don't know that their homes are being used as independent boarding cares. And so it's not until generally, numerous violations and calls from Sounds APD that a home is then kind of marked as an independent home. And generally they follow up with the landlord. And at that time, many landlords are starting to realize how their homes are being rented out. Barbara, you have a great question about credit score. And so when we start looking at social determinants, that's one of the main factors, right? As far as that's the socioeconomic of many of our clients. Most of our clients that are in the behavioral health system are either on SSI, SSA, SSDI, some are undocumented, and they do not earn no more than $15,000 a year. And so when we even look at affordable housing, what's available for limited tax credited properties, many of our clients don't even qualify for that. And then you factor in other determinants as far as not a stable employment, poor credit score, don't have anyone to co-sign for them. You know, our clients are really left to fend for themselves. And so, you know, this is one thing here at Momentum that we're really striving is to make affordable housing for clients that are coming through our doors to where they're not jumping through these hoops and being able to really, you know, maintain a sense of stability so they can start focusing on their recovery and their treatment.
Yeah, I mean, we're getting a lot of questions about, you know, what are the steps a person needs to take to access these housing options, you know, because just applying for housing out on the market is just prohibitive to a lot of people. So someone who's struggling with behavioral health issues, what would be some steps they can take to get access to some of these supported housing?
You know, Dr. Shefali, one step they can take, I always advise folks that are looking for affordable housing to try to get on many wait lists as possible. The county actually, through Office of Housing Support, they actually have new development that's coming online. Generally, you can get on a wait list, similar to Mara's situation, to where she was able to get on a lottery. There's other affordable housing programs through Charities Housing, Mid-Peninsula Housing too, that are very familiar with the population and very understanding. So, you know, I would seek out housing development agencies as such for clients that are coming through our doors, whether they're going through crisis residential program, as long as they meet our eligibility criteria, everyone has the access to affordable housing coming through our doors. We understand that there's different types of housing for different types of folks, depending on where they are in their recovery. Some need a little less, which independent supportive housing transitional may be great. There's some that need more, and when we start looking at more structured, more looking at our adult residential treatment programs. And then you have some that you're just not ready. However, during emergencies, we do have crisis stabilization type housing that's available on a short-term basis.
Great. Thank you for that. And you know, there's questions that are coming from people who are seeking these housing options, as well as people who are looking to support this effort. And so how can supporters help? You know, what options are they? We're facing such a crisis right now, a shortage of housing, a shortage of people like us who want to get in there and provide the housing. How can supporters help us?
Yes, that's a great question. You can donate, connect with us. Let's open up a dialogue. More importantly, you know, it really takes a village to tackle the housing crisis that we're dealing with. And so just bringing on more partners. You know, I think that's a start to at least to kind of figure out which direction we can go in. You know, clearly the more the merrier. And if there's any organizations out there that are interested in looking at ways in which we can, you know, open up the dialogue and start exploring conversations related to bringing on more housing here in Santa Clara County, please reach out to us. They can contact us, you know, on our website. We're on basically the 4 social media platforms, which is a later slide here. But yeah, the best way you can do is just connect with us. Let's start that conversation.
Excellent. Thank you. I have a question here about a report in the Mercury News about affordable housing going up on the Momentum site at the Alameda. And, there's some story to that. And I don't know if you wanted to share a little bit about that.
Unfortunately, I'm not sure what is going to be kind of stood up at Momentum. I'm assuming that's at 2001 location, correct?
I would assume, I don't know the story they're referencing, but they said the Momentum site on the Alameda.
Okay. Yeah. You know what? What question is that? Who's asking that question? We'd definitely love to get back with them. So if they
Okay.
can leave us a contact, I'd love to follow up with them on that.
Absolutely. Let's see. Some cities are exploring the use of repurposing of hotels and motels as affordable housing. I know this is going on. It's one of Governor Newsom's plan that's actually playing out. And the question is whether this lines up at all with Momentum strategy as an option.
Yes, it does. And so what we're looking at here is when we start looking at repurposing hotels and motels, we're looking at SROs. And so if the opportunity's there, it's in alignment with our mission and vision, and whether it's collaborative efforts and or someone gets wind that this is coming online, we would definitely love a call, and it's something to explore. When we are looking at our housing services across a continuum, we want to make sure we're tapping in to all the populations that we serve, right? So we do serve transition age youth, we have adults, and we have older adults too. And so for us, we're looking to provide as many opportunities as possible for clients that are coming through our doors, and looking at many different types of housing too. So yes, that is definitely a strategy. I also know that, with the county, they've also created, developments, repurposed hotels. There's quite a few homes that are being stood up or have been stood up off of Monterey Road. And so that is a viable option, as long as it makes sense and we're able to pull it off. Absolutely. It's a need.
So basically, everything's on the table. We look at every option and consider what we can do to help.
Yes, we got to get creative. The traditional kind of outlook, buying properties, that's just more of a grassroots. But in order to serve more and provide more opportunities, we have to look at multiplex dwellings and so forth. And the key in all this here is making it affordable.
Absolutely. We're getting a lot of questions about that, a lot of comments about that. It's just not affordable anymore. And that's at the core of the struggle here, I believe.
Absolutely. And I want to add this, Dr. Shefali. So when we discuss affordable, there's certain criteria that's defined by housing of urban development, right? For the most part, affordable means, clients are not paying more than 30% of their income. When you're on a fixed income, that's a lot. When you're bringing in $741 to $1,041, there's really not much more, you can do in trying to maintain, not only your rent, but then also important needs that are essential for stability and security in the community. And so for here at Momentum, we really do try to work with our clients. Yes, there's different sites have different income levels, but we don't turn our back on our clients. If it's something that we can do, knowing that they may be falling short, sometimes depending on what program you're in, there's additional flex funds that programs can support with. And then also there's dollars that have been donated that can be used to support clients with their housing. So again, we really try to meet our clients where they're at.
That's just wonderful. And I think, at this point, we've run over on time. It's been a really lively conversation, really amazing questions. I want to just mention one thing. We got a response from Regina Williams, the executive director of Silicon Valley at Home, and has actually been involved in this effort to develop the site, the 2001 Alameda site for Momentum. First Community Housing in the African American Cultural Center purchased and are developing the site. I have been consulting on the development. It will have affordable housing. So good news there, good things to come.
Thank you, Regina. I just didn't want to get into the details, but yeah, it's definitely great to hear. The county definitely needs it.
And so what we have up on the screen here is our contact information, ways to connect with us, ways to follow us. And that would be the best way to get some of these other questions answered that we weren't able to get to today. But it's been a real pleasure to share this time with you all and talk about this really important issue. Thank you, Cedric, for sharing your expertise in this area and all the things that you're doing.
Thank you all. I appreciate coming out and listening. And again, please let's connect. You can reach me through my Seth C. Anderson at momentum.org. I definitely want to continue these conversations.
Great. Thank you, everyone. Have a good evening.
Take care.
Bye.